everyone, welcome to Vasomeritech Heal Your Heart EECP Treatment Center. What if I told you to your face directly that the most common procedure we do in cardiology is basically same as a fake surgery? It should be very surprising to you because lakhs and lakhs of people every year undergo this procedure across the globe, and still there is no significant evidence to show this treatment is much better than a fake surgery. So as a patient, if you go to a cardiology clinic as a stable patient, which you go to the regular outpatient, and if you have done an angiogram earlier and identified the block, then the cardiologist immediately seeing the block, his reflex would be that immediately you need to do a stent at the earliest. Otherwise, it could be difficult. You may have more pain. Your quality of life would be affected. In fact, it can progress to lead to death and heart attack. Now, this is a basic conversation with every patient with a cardiologist. I'm not changing this in any way. Now, what does a stent do anyway? So this cardiologist, once they decided to put a stent, they open the vessel by using a balloon, which is called balloon angioplasty, and then a wire mesh called stent is placed inside, and this is called angioplasty with a stent. And once this procedure is done, what is the outcome which is expected is the vessel is now open, the blood can flow through the open vessel, and then the patient pain will get fixed, and then once the pain is fixed, he can able to walk more distance without getting any discomfort. Quality of life is restored and the patient become healthier than before. And this was an assumption which has been going on for the past 50 years and a free run, and no one has questioned the ability of an angioplasty to reduce the pain in stable patients. That is the reason in a span of 50 years it became a multi-billion-dollar industry. And finally, this assumption was questioned by a group in UK, in London, and in fact they initiated a trial called ORBITA Trial, and this is a very groundbreaking trial because it made us to change our mind to believe that stenting is actually has a placebo effect and it is very similar to a fake improvement rather than an actual improvement. And how can you conclusively say this, doctor? Because this has been going on across the globe, and how can you defy it, or how can you say it is no? Now the answer lies in the finding from this ORBITA trial. So what ORBITA trial done is what the procedure, the trial detail, which I will discuss in a later, but what actually did is they took around 200 patients. Now all these 200 patients have stenosis or blockage, which is definitely more than 80%. So these are all the patients your cardiology would say definitely you need a stenting. Now 200 patients has been advised by the cardiologist to go for an immediate stenting. But what this investigator did this, they divided them into two groups. Each group will have 100 patients. So the first group, they took them to the operation theater or a cath lab, and they did an actual procedure. They put a stent. And the next group, the next 100 people, they took the same operation theater. They informed the patient that they're going to do a stent. And in fact, while the patient is on the minor sedation, they've been speaking to the patient that they were doing a stent. But actually, it was a fake surgery. The stent was not placed at all. Now, all these patients are being kept on a follow-up. So 6 weeks later, these patients are called back for evaluation. So you should remember, now all the 200 patients, they believed that they had a stent. So when they went for a clinical evaluation for assessment, all of them said definitely they have improvement in their angina. It means the chest pain has come down drastically. They were able to do more walking than before. Their quality of life, the regular activity they do significantly improve, and all the parameters improvement is similar in both the group. Now this is a very astonishing finding because one group did not go for actual stenting, but in spite of that, their clinical benefit is equivalent to, or in fact it can be much better than what the people who undergone a stent. Now this confused everybody because 50 years we thought this angioplasty is going to help you by relieving your chest pain. Now there is a trial which is a first randomized trial which is showing the opposite effect. Now this is what every patient should understand, what it is called a placebo effect. Now what is a placebo effect? It is usually seen in most of the surgeries. Once the patient believes that they have undergone a treatment, automatically they feel better. Now this is what contributing to the reduction of symptom in patient who undergoing an angioplasty, because you should always remember, once you are advised for angioplasty, there is a group of cardiologists will speak to you, and then they will take you to the cath lab. Then the lot of investigation is done, and finally they will show you a film where the vessel is blocked, and they put up a stent and they show you it is open. Now doing all these things has have an impact on the patient, and they made them believe they are better, and this is a reason the chest pain gone. Now if the treatment per se is giving all the benefit, then the placebo group, the group which did not have this stent, should not have any benefit, but they do also have the same benefit. So this is a very strong placebo effect in patient undergoing this angioplasty. Now, in spite every cardiologist knows about these findings, which is not a simple finding. It came from a UK university and it is not a simple publication. It was published in Lancet, one of the most prestigious cardiologist journal in the world, and also it has been incorporated in the guideline and it has been taught in the schools and also been written in textbook. In spite of that, there is a clear lacuna where the cardiologists, when they speak to the patient, they absolutely become biased and they obstruct this finding, and they inform the same way that doing an angioplasty will help you reduce your chest pain and improve your exercise tolerance. In fact, there is another parallel treatment which can do better than actual this what stenting can achieve. The same placebo control trial where they do an actual treatment and they do a fake treatment. When they apply to EECP, enhanced external counterpulsation, the patient who undergone this enhanced external counterpulsation, they certainly did better than patient who undergone a fake external counterpulsation. So here the active people who have actually undergone this EECP feel better, the chest pain reduced, the quality of life improved, and also when they put on a treadmill, they achieved much better result than the people who did not undergo the treatment. So what we are trying to imply is, current scenario, EECP would be a better option for patient with stable angina with coronary stenosis. So this is a treatment which should be implemented and should be given to the patient before they've been pushing to go for interventional procedures which carry high risk and also no benefits.